women today. It's to send the message that heart disease is not just men's problems. Caroline in the morning is in Curtin live right now at Hanover Regional Medical Center. She's talking to some doctors there this morning about what you need to know. Lindsay.
Good morning, Kim. Yeah, we're live here at New Hanover Regional Medical Center in the Heart Center. This is the rehab room, really. It's where people come to get back in fighting shape after they've had an issue with their heart. The first 6 weeks they're monitored, and then they become part of a program where they take classes really to get back in healthy shape after they've had such, a detrimental issue to their body, heart disease. And like you said, it's not just an issue that affects men. It strongly affects women. That's why it's Wear Red for Women Day. Heart Disease Awareness Month. We're here with David Parks with New Hanover Regional Medical Center Cardiac Support Services. I wanted to ask you about that alarming statistic you told me in relation to heart disease in women and breast cancer.
Yes, it's important for people to know that breast cancer is very important for awareness, screening, and treatment. But heart disease kills 5 times more women than breast cancer does. So it's also very important to know the signs and symptoms, to take definite action on prevention of heart disease, and know the signs and symptoms of a heart attack are different for women than men.
And we're going to have a full segment on the signs and symptoms coming up a little bit later in the show. But I wanted to ask you about that prevention aspect that you were just talking about.
Okay, one of the best things of prevention is lifestyle, and it's a personal choice you need to make. The diet and the exercise are the most important things. If you do need treatment for high cholesterol, get with your doctor and get that. We do have a cardiac screening that we can do that's a CT scan, no needles, and we can detect how much calcium is in your coronary arteries. And it will help give you a definite decision on, wow, I do have heart disease and need to do something right away, or I have a little more time and need to make sure I'm active in my prevention.
So that's really what is new on cardiac care that people would be excited to know about if they have had someone in their family who's had issues with their heart. I mean, it's nice to know that there's some new stuff happening out there.
There are, and if you're over 50 years old, it's good to get a scan to see where you are with it. They're easy. They're available here. There are a lot of other things that we also are doing in terms of treatment. We're working on a valve center so that some people have trouble walking to the mailbox or getting in and out of the grocery store because they have insufficient valve. And we're working on helping detect that and treat that with all the latest techniques.
Fantastic. I appreciate your time this morning. We're going to be live here with more details on signs and symptoms of heart disease and other new preventative methods that are out there in the medical world. But for now, we're going to send it back to you in the studio.